So this chapter, chapter 18, working with trauma-related mental health problems among combat veterans of the Afghanistan and Iraq wars. How many veterans do you work with? I rarely get an opportunity to serve the veteran population. I think a lot of times they are treated by therapists within the Veterans Administration hospital system. Sometimes if there's a backlog, we might get a chance to do some orthopedic work. There are many things that can cause trauma within a war setting. Listed here are some traumatic combat incidents. So these wars, the ones that led to many veterans or led to many Americans participating in war within Afghanistan and Iraq, these are some of the longest running wars since the Vietnam War. Now, medical advances have increased the survival rates of soldiers with significant injuries. Many, though, have come home to face mental health problems, and the rates were higher among those with repeated deployment. So looking at psychiatric and readjustment problems, mental health problems among veterans have been divided into post-traumatic stress disorder, other psychiatric disorders, and traumatic brain injury. PTSD may develop in relation to a number of different types of trauma, such as physical and sexual assault, combat exposure, natural disasters, motor vehicle collisions, and other kinds of accidents. PTSD most likely due to combat, assault, and sexual assault. PTSD as a psychiatric disorder requires exposure to a traumatic stressor representing a threat to life or limb. The diagnostic criteria allow for three types of qualifying exposures: direct experience, directly witnessing the event, or learning of the experience of a traumatic event by the loved one or by a loved one or a close associate. Symptoms include intrusive recollections, nightmares, flashbacks, emotional or psychological distress, avoidance, hyperarousal symptoms, including sleep disturbance, concentration problems, hypervigilance, exaggerated startle response, jitteriness, and irritability. PTSD is typically accompanied by at least one other disorder and often several disorders. Some of these other psychiatric disorders include major depression, anxiety, substance abuse disorder, and adjustment disorder. Traumatic brain injury is a common injury experienced during war. A traumatically induced structural injury and or physiological disruption of brain function resulting from an external force, immediately followed by a new onset of worsening of at least one of the following clinical signs: any period of loss or a decreased level of consciousness, loss of memory for events immediately before or after the injury, alteration in mental state at the time of injury, and neurological defects. Looking at treatments for veterans, and again, the general purpose of this chapter was looking at the psychosocial side of things. Pharmacotherapy. Prescriptions include that may be used antidepressants, anticonvulsants, atypical antipsychotics, and anti-anxiety agents. Psychotherapy that might be used includes cognitive behavioral therapy, PE therapy, eye movement desensitization and reprocessing, stress inoculation training, acceptance and commitment therapy, family therapies, virtual reality therapy, and there are potentially others. Recent research has focused on both pre-trauma and post-trauma risk factors for PTSD. There is considerable evidence that the degree and the type of trauma exposure experienced by service members during deployment increase the likelihood of deployment-related mental health problems. Although the majority of returning troops do not experience psychiatric illness after homecoming, many experience adjustment problems. The first adjustment for veterans returning home is the loss that they may feel on separation from the tight camaraderie of the military unit that some veterans describe as more like a family than even their own families. Once home, veterans may experience difficulties reacclimatizing to the rapid transition from a combat zone to civilian life. They may face adjustment issues in relationships disrupted by deployment, problems redefining roles in the home, and other readjustment problems such as negotiating difficult vocational and occupational choices. Couples must navigate fluctuations from interdependence to independence and back again, which can create conflicts and role confusion. Marital relationships may become strained as veterans and their partners seek to renegotiate roles and reestablish intimacy, particularly among veterans with PTSD. Spouses of deployed veterans have been found to have greater prevalence of depression, sleep problems, anxiety disorders, acute stress reactions, and adjustment disorders compared to spouses of non-veterans.